Okay, students, we are doing this exam to demonstrate a general physical exam as we would expect you to do it in an OSCE. I may make mistakes. I will hopefully appropriately correct them as we go. But this is similar to what we'd expect to see when you're doing an OSCE after the first semester. So I've already come in the room. I'm going to introduce myself without shaking hands in the era of COVID-19. And hi, are you Mr. Fisher?
I am.
Yeah, what's your whole name?
Scott Douglas Fisher.
Okay, and what's your date of birth?
September 9th, 1971.
Okay, I'm Dr. Morris. What brought you in today?
I'm just here for a full physical.
Okay, good. We'll go ahead and do that for you. Are you having any problems right now?
Nope.
Okay, no symptoms, no problems with weight loss or weight gain,
Nope.
night sweats or fevers, haven't had any respiratory issues. Okay, I noticed that the nurse has taken your vital signs, so we've got a normal blood pressure, pulse, temperature, respiratory rate, and good body mass index. So I'm going to start by examining your head and neck, and then we'll kind of move down from there.
Okay.
Okay? So no problems with headaches. You haven't had any head trauma?
Nope.
Okay. None of this is sore or tender?
No.
Okay, I'm just going to tap over your sinuses. Does that hurt?
No.
Okay, this is your jaw joint. Does that hurt?
No.
Open your mouth, close it. Okay, and I'm going to feel for lymph nodes. And there are a bunch of lymph node groups. So some people say this feels like a neck massage. I want you to shrug up your shoulders, and I'm going to feel down here. Okay, so I don't feel any lymph nodes that concern me. I'm going to take my otoscope, and we're going to look in your ears. Does it hurt when I pull up like that?
No.
Okay. And everything looks nice and normal in there. How about over here? No?
Okay. No.
Okay, good. I'm just going to glance into your nose if that's okay. Are you having any nasal symptoms, congestion, or nosebleeds?
No.
Alrighty. I'm going to look in your eyes. Just look at me. Now, you've got nice light-colored eyes. And I'm getting a good pupillary reaction, but sometimes people with dark-colored eyes, it's helpful to darken the room when we're checking pupillary reactions. Okay. I'm just going to pull down your lower lid, looking for pink eye or any inflammation there. So no problems with your eyes or with your vision?
No.
Okay, good. I need you to open your mouth real wide. Okay, and I'm looking at the roof of your mouth and at your teeth, and your teeth look nice and healthy and well cared for. I'd like you to open your mouth real wide, stick your tongue out, say ah. Very good. And then put your tongue up on the roof of your mouth so I can look at the bottom. Very good. We're going to check the motion of your eyes. So I want you to look at my nose for now. And I'm going to put my finger out here. I want you to follow it all the way in. You can look at my finger. Okay, I want you to look out at the wall. Now look at my finger. And now follow the motion of my finger out to the sides. And I'm looking to make sure all of the muscles that move your eyeballs are working in a coordinated fashion. Very good. Okay, the next thing I want to do is look inside your eyes. And for that, again, I can dim the room, but I don't necessarily have to. So we'll see how it goes without dimming the room. This is a bright light and it can be a little uncomfortable. Also, you're a good deal taller than I am, so I'm going to ask you to lean forward a little bit and then look forward. And I'm going to look directly inside your eye. And what's interesting here is that I can see your retina and your blood vessels and your optic nerve. It's the one place, it's like a little window into the body where we can see blood vessels and nerves directly. Very good. I don't see any evidence of increased pressure or of ongoing hypertension or diabetes. Everything looks nice and healthy. The next thing we're going to do is check to make sure that your retinas both work normally. So I want you to cover your right eye with that hand, and looking at me, just look at me, tell me how many fingers I'm holding up.
3.
Okay, how many fingers am I holding
4.
up? Now switch eyeballs. Okay, how many fingers?
2.
How many fingers?
3.
Okay, good. Are you having any trouble with your sense of smell?
No.
Okay, I'm gonna just stand behind you, and here, you tell me which side I'm rubbing my fingers on. Can you tell? No?
Nope.
Okay, I'm gonna whisper, standing back a little further, cover your left ear. I'm gonna whisper, and you tell me what I whispered. 1, 2, 3.
1, 2, 3.
Okay, let's try the other ear. I'm gonna whisper, E, F, G. What did I whisper?
I'm not sure. One more time.
Okay, I'm gonna get a little closer. E, F, G.
E, F, G.
Okay, very good. Have you had some problems with hearing loss?
I don't think so.
Okay, good. I am going to do one other thing with your neck and shoulders, which is that I want you to turn your head against my hand that way, and turn your head against my hand that way, and then shrug up your shoulders while I push down. Very good. I'd like you to turn your body that way, and I'm going to be pulling up your shirt and checking some things about your chest and your lungs. Is that okay with you?
Sure.
All right. This is called percussion, and it gives me an idea of what's going on inside your lungs. Now I'm going to listen to your breathing, and what I need you to do is breathe in and out with your mouth open, and every time I move, do the same thing. And I'm listening to all of inspiration and all of expiration. Okay, you getting dizzy?
No.
Okay, I'm going to do just a couple more, and then we'll move to the front. Okay. I'm going to move around to the front side, and I'm going to percuss a couple more places. And I'm going to listen to your breathing in the front. I want you to take big breaths. And I'm looking at your skin, and I don't see any worrisome skin lesions. That's one of the things, if you've been in the sun a lot, we have to pay attention to. All right. The next thing I'd like you to do is lie back on the table. Let me pull this out for you. It makes it a little more comfortable. And I'm going to be feeling on your chest wall to find the place where I feel your heartbeat. So just relax. Good. And now I'm feeling to make sure that there's no enlargement of your heart. Very good. And I'm looking, yeah, nice venous pulsation there. So that just tells me that your pressures in your heart are normal. I'm going to listen to your heart, and I'm going to listen in several places and for a few seconds at each place. So just bear with me. In most patients these days, we work around clothes. And talking to my students and not to my patient, I'm using light pressure and firm pressure. And I usually go from above for the aortic and pulmonic areas, and then from below for the tricuspid. And then finally, the mitral. Mr. Fisher, just roll up a little bit onto your left side, and I'm going to listen out here. Okay, great. Sounds like it's time for lunch. Go ahead and roll on your back again. Now, when we examine your belly, I need to see it. So I'm going to pull your shirt up again. And I might even pull your shorts down just a little bit, just so that we can see all the way from the pubic symphysis to the xiphoid. Everything looks normal. I'm going to listen, and we'll just hear gurgles and bubbles. If I didn't hear ball sounds, I'd stay in one place and listen for a while. I'm also listening for bruits over the aorta and the kidneys. And I'm going to slide my stethoscope right under your waistband, if that's okay.
Mm-hmm.
Okay. And over the femoral artery. Good. And while you're lying there, I'm going to listen on your neck. Probably should have done that first. Good. And I'm going to feel those carotid pulses. Okay. We're going to feel your pulses in your wrist. And I like to do that at the same time to compare. I'm going to feel for a pulse behind your knee. Helps to bend them up just a little bit and hold them up. Posterior tibial. And we'll take your shoes off a little later and check that last pulse. Okay. I'm going to feel your belly. Do you have any tenderness or soreness anywhere?
No.
Okay, good. I'm going to go a little deeper this time. So no problems. Good. Okay, now I'd like you to bend your knees up. You can just relax your belly a little bit, and I'm going to be checking for your liver size. So try to relax. Take a breath in. Let it all the way out. Okay, take a real big breath in. Good, and that's nice and normal. Same thing on this side. Breathe in. Breathe all the way out. And breathe in deeply. And your spleen, I can't feel it, and that's what we like to see. I'm going to have you sit up again if you don't mind. I'm going to pound you down the back. Does that hurt anywhere?
No.
Okay. If you were a woman and this was an annual exam, I'd probably do a breast exam. If you wanted as a guy, I'd ask, do you want a hernia exam and a testicular exam, because they're not recommended as screening exams, but they can be part of a normal exam. Rectal exams usually saved for indications where we actually need them. And you're not having any rectal bleeding,
No.
any GI problems.
I'm not.
Okay, I didn't ask about cough or shortness of breath, any chest pain or heart palpitations. Okay, good. And you don't get short of breath at night when you lie down in bed?
I do not.
Okay, very good. I'm going to check your just general sensation. Does it feel about the same on both sides? There and there.
Yes.
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 Okay. How about on the outsides of your legs?
Yes.
How about on the insides?
Yes.
Coming down the same?
Yes.
Okay.
Yes.
So no areas that seem numb.
Everything's the same.
Okay, very good. How about your face?
Same.
There, there,
Same.
there.
Yes.
We're gonna make some silly faces at each other.
Okay.
I want you to raise your eyebrows. Good. Good forehead wrinkling. Okay, I want you to close your eyes real tight. Don't let me open them. Squint them. Okay, good. Open your eyes. I want you to puff your cheeks out. Okay, show me your teeth. Okay, very good. Clench your jaw down. I'm going to check some strength in your arms. So make chicken wings for me. Don't let me push them down. Hold them like this. Don't let me straighten them. Okay, push me and straighten them. Okay, good. I want you to raise this leg against my hand, raise this leg against my hand. Push both legs out. Bring both legs back. Push both feet up. Push both feet down. Good. I want you to grab my fingers and squeeze really tight. Tighter, 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 tighter. Good. And I want you to make your hands like that and don't let me squeeze your fingers together. Very good. I'm going to check some reflexes. I brought my built-in reflex hammer with me. Good. Okay. That one's a little harder for me to get sometimes. Okay, I think we got a thumb twitch. Give me this arm. Just hang your arm on my arm. Very good. Very good. You've had some surgeries on your... Okay.
Both of them.
Both of them. Good. And then I'm going to do the legs, knees. Okay. That reflex seems a little brisker. Yeah, they're about the same. And then we're gonna... Good. Good. Very good. We're gonna have you take your shoes off in a minute, but first I want you to stand up for me. And I'd appreciate it if you would walk over to that corner and then just turn around and walk back. Okay, now go back to that corner on your tiptoes. Come back to me on your heels. Very good. An alternative way to check your lower extremity strength would just be to have you squat and then stand up straight. Okay, very good. Now I'm going to check your balance. So I need you to put your feet together without quite touching. Put your hands out with your palms up. Very good. And I'm going to be right here, so if you fall, we'll have you open your eyes. But I need you to close your eyes and just keep them closed. And everybody wobbles a little bit, so don't worry about the wobble. All right, very good. Now, I want you to sit back up here and take your shoes off for me, if you don't mind. Okay, I'm going to check an additional pulse that I didn't check earlier. And I'm going to check one more reflex that I didn't check earlier. Oh, that's interesting. Let's try that again. All right, good. Okay, good. And that's one that maybe a reflex hammer works a little better than a thumb, but we can try the thumb. Do you feel about the same on both sides there?
Yes.
And there?
Yes.
Okay. And I want to look at your... Very good. All righty. I did not check your femoral pulses, and I would if I was doing a full exam. Is there anything else you want to address or any concerns you have? Looks to me like you are in good physical shape. The exam was normal except for the things you know about, like you have some obviously shoulder issues, but you've got great strength and great range of motion. And if you have any concerns, just let us know. Do you have any questions for me?
No. No.
All right, terrific. Again, we're avoiding handshakes in the era of COVID-19, but let me know if there's anything else we can do to help.
Thank you, Dr. Morris.
All right. So I didn't time that, but I will. It was 20 minutes. There was a little extra talking. I'm going to go ahead and do some editing on this if necessary, but I hope it helps to just see the sequence and the flow and how you talk to your patient. Thank you.